moving on to what orientation jaw relation. This is the first jaw relation that has to be recorded. It records the relationship of the maxilla to the base of the skull or the cranium, and it establishes the angle or tilt of the maxilla with reference to three planes, that is, two posterior reference planes and one anterior plane. The mandible moves against a fixed maxilla, and it is important for us to accurately reproduce these mandibular movements. For this, it is necessary to establish an accurate plane of occlusion which can be used as a reference for obtaining occlusion or arrangement of teeth. It records the angulation of the maxilla, that is, a plane that should be formed with at least 2 points in the posterior region and one anterior reference point. For that, we need to be knowing what is called as hinge axis, which is an imaginary line around which the mandibular rotates from one center of the condyle to the other. Now, which in all conditions phase bow is mandatory? Whenever balanced occlusion is desired, or when cusp form teeth are used, when intraocclusal check records are used, in full mouth rehabilitation, when you need to be doing comprehensive fixed dental rehabilitation, or when vertical dimension is going to be altered. So, in these situations, use of phase bow is mandatory. The advantages are it secures the anteroposterior positioning of the cast with relation to the condylar opening axis of the condyle. It registers the horizontal relationship of the cast accurately as how it is shown in the patient's mouth, and it aids in alteration of the vertical dimensions of the cast in the articulator. It also permits more accurate use of lateral rotational points for arrangement of teeth. Now, this picture clearly shows this is a Hanau spring phase bow, and these are the parts. This is an arbitrary phase bow, and this is an earpiece type of phase bow, wherein there are two nylon plugs which are going to be seated inside the external auditory matters of the patient. Now, these two serve as the two posterior reference point, and this is an orbital pointer which is used as an anterior third point of reference, and this is the U-shaped frame which extends from one part of the face to the outside to the other side, and this is the bite fork, or this is the stem, and this bite fork has to be seated or inserted into the occlusal rims and placed intraorally for recording the orientation jaw relation. And then we have the transfer jig assembly, which is used for transferring the articulator. If you see, there are two types of bite forks. One is in the form of 4 forks that is used for completely edentulous patients. The other one is in the form of a plate, U-shaped plate, which is used on dentulous patients. This is the bite fork which is used for dentulous patients, and the other one which is used for edentulous patients. Now, once the anterior points and the two posterior points are stabilized, you need to be using 3 locking device, a locking clamp for locking the bite fork. This attaches the bite fork to the U-shaped frame, and the locking clamp for orbital pointer locks the orbital pin onto the U-shaped rod. There is another locking screw for the condylar rods. By this way, all the 3 planes, antero-posterior, supero-inferior and mediolateral, are stabilized for obtaining the plane of occlusion. Now, justification for use of phase bow. Studies show that even a small error in location will only have a negligible effect on occlusal level. This is because of the presence of resiliency and life effect, which is called as real F effect, which was given by Hanau, and hence because of this there is negligible amount of perception from the patient's side, and the error is insignificant for most removable dental prostheses, but however, use of phase bows is mandatory for comprehensive fixed dental treatment.